Okay, I'm going to tell you one of the biggest lies in nursing school, and it's thinking that if you memorize everything that you're going to pass your classes, but I promise that you're not. You need to know the fundamentals of nursing, which are thinking like a nurse, knowing Maslow's hierarchy of needs, knowing your ABCs in nursing, and just knowing prioritization. Okay, so in this video, we're going to talk about all of these things in depth, and then we're going to do 5 NCLEX-style questions at the end. Okay, so how do nurses actually think? So here's the biggest mindset shift that you're going to have to make in nursing school. As a nursing student, you're trying to answer the question. As a nurse, you're trying to solve a problem. So these are two completely different things. When you walk into a patient's room, you're not thinking, what chapter did this come from? You're thinking, is my patient okay? What's my biggest concern? What am I going to do first? Because here's something that you're going to hear over and over again in nursing school. Everybody has a problem. Every single patient. One patient has pain, another one is nauseous, another one has anxiety, another one can't breathe. So let me ask you something. Can you fix everybody at the same time? No, you can't. That's why prioritization exists. You, as the nurse, are deciding who you need to see first. Okay, so this is why nursing school gets really frustrating. So sometimes every answer on the NCLEX is technically correct, not only on the NCLEX, on your every nursing exam. And you're looking at the question thinking, well, I could do all 4 of these. And you're right, you probably could, but that's not what the NCLEX is asking. The NCLEX is asking which one comes first. That is the difference. So I'm going to give you an example. So you have 2 patients. Patient number 1 says, my pain is a 10 out of 10. Patient number 2 says, I can't catch my breath. Both of these patients need help, but who are you going to run to first? Think about it. Who are you going to run to first? The patient who can't breathe. Why? Because pain is important, but oxygen keeps people alive, right? You see the difference? That is nursing prioritization. So here's another example. So you have a patient that says, I'm really anxious, and you have another patient that is actively bleeding. Who comes first? The bleeding patient. Because anxiety matters, it matters, but we have to stop the life threatening problem first. This is why I always tell students stop looking for the best answer and start looking for the first answer. Here's the biggest lesson I can teach you today. Every NCLEX question is really asking you just one thing. What will hurt my patient first? Not tomorrow, not in an hour, not after lunch, right now. If you can answer that question, you've already eliminated half of the answer choices. So from this point forward, every time we learn a new framework, I want you to think of it as another tool. Each framework helps answer the same question. Who needs me, the nurse, first? That's exactly why nurses use things like the nursing process, which we will talk about, Maslow's hierarchy of needs, the ABCs. These aren't just random things that your instructor or your institution wants you to memorize. They're tools that are going to help you make safe decisions. And again, not only for the NCLEX and your nursing exams, for your career. You need to be a safe nurse. You need to know these frameworks. You need to know these things. These are the foundations of nursing. Okay, so we're going to start with the most important one, which is the nursing process. Okay. Alrighty, so everyone has a problem. Who needs me first? We're not finding the best answer, we're finding the first answer. You need to ask yourself, what will hurt my patient first? So let's talk about what the most important thing that you're going to learn in nursing school, which is the nursing process. Okay, so you've probably heard your instructor say ADPIE, ADPIE, and you're probably thinking, great, another acronym that I have to memorize in nursing school. But here's the thing: it's not something that you have to memorize. It is how the nurse thinks. Okay, that is the cracked code. So what does ADPIE stand for? It stands for A, assessment; D, diagnosis; P, planning; I, implementation; and E, evaluation. It's simple, but here's what I want you to understand, okay? So the NCLEX is obsessed with the nursing process because it wants you to know, can you think before you act? So let's break it down. Okay, so assessment. This means that you are gathering information before you do anything with the patient. So you're looking at your patient, you're listening to them, you're checking vital signs, you're asking questions, you're collecting data. Think of yourself like a detective. You don't solve the mystery before collecting the clues, right? You collect the clues first. So let's say that your patient tells you, I'm having chest pain. What is the first thing that some students want to do? As a student, you're like, give nitroglycerin, right? But hold on. The NCLEX is going to ask you, what should the nurse do first? Before you treat the chest pain, you have to assess it. You have to ask the right questions. You have to check their vital signs, get more information. And if you skip the assessment, you might treat the wrong problem. Okay, so next is diagnosis. So this is where a lot of students get confused. A nursing diagnosis is not the same thing as a medical diagnosis. This took me a long time to understand. Okay, a doctor diagnoses diseases. A nurse identifies how the patient is responding to those diseases. For example, a doctor might diagnose heart failure. A nurse might identify decreased cardiac output or excess fluid volume based on the patient's symptoms. You're not diagnosing the disease. You're identifying the patient's nursing problem so that you can plan care. Okay, planning. Now that you identified the problem, you're going to make a plan. So, what is the goal with this patient? What do we want to happen with this patient? Maybe we want the patient's oxygen saturation above 94%. Maybe we want their pain reduced. Maybe we want them to safely walk to the bathroom without falling. Planning is simple. It's asking, what is my goal? Okay, so implementation. Now and only now do you actually do something. This is implementation. This is administering medications, repositioning the patient, educating the patient, calling the provider. This is carrying out the plan, okay? This is everyone's favorite step because nurses like doing things. But here's where students get trapped. Okay, so the NCLEX loves to give you an intervention when you should still be assessing. So don't fall for it. If the question says that the patient suddenly reports a new symptom, ask yourself, do I have enough information about this yet? If the answer is no, then you're probably still in assessment. And finally, E, evaluation. Did your intervention as the nurse actually work? You give pain medication. Did the pain improve? You give Lasix. Did the swelling decrease? You reposition the patient. Are they breathing better now? If the answer is no, then you reassess. And the whole nursing process starts all over again. So, an easy way to remember ADPIE is assessment, you're collecting the clues, diagnosis, what is the problem, planning, what is the goal, implementation, do the intervention, and evaluation, did it work? Think of it like baking a cake. You don't put the cake in the oven before you read the recipe, right? And you definitely don't tell everybody that the cake tastes amazing before tasting it yourself. The same thing applies in nursing. You assess first, then act. Now we're going to talk about Maslow's hierarchy of needs. When I first learned about this, I just brushed it off when I was in nursing school and I was like, oh my gosh, another boring pyramid that I have to look at. But you know what? You need to know this. This is the framework for everything in nursing school, okay? So before you roll your eyes when you look at this pyramid, I promise this is gonna make sense the way that I'm gonna explain it, okay? So most nursing students try to memorize this pyramid. Don't do that. Instead, imagine that you're building a house. So you wouldn't start decorating a bedroom if you haven't even poured the foundation yet, right? So the exact same thing happens, I'm sorry, the exact same thing applies to your patients. You can't worry about the top of the pyramid if the bottom is falling apart. So we're going to start at the bottom. So these are physiological needs. This is everything that your body needs to stay alive. Think air, water, food, circulation, temperature, elimination, and sleep. Without these things, nothing else matters. If your patient can't breathe, they're not worried about watching Netflix, right? They're not worried about their discharge instructions. They're not worried about what they're going to have for dinner. They need oxygen. That's why physiological needs are always first. This is our foundation. Okay. And then next is safety and security. Once you're, sorry, next comes safety and security. Yes. Okay. So once your patient can survive, now we have to keep them safe. Think about things like fall precautions, infection prevention, bleeding, medication safety, making sure that the patient does not get hurt. Here's an NCLEX example. You have two patients, okay? One of them is anxious because they just got admitted, and the other one keeps trying to get out of bed when they're a high fall risk. So, who do you see first? You know this. Who do you see first? The fall risk patient, because safety comes before emotional needs. Okay, so next on the pyramid is love and belonging. This is family, friends, support, feeling connected. These things matter, but if your patient can't breathe, that's not your priority. Okay, so esteem. This is confidence, independence, respect, helping patients do things on their own, encouraging them, building confidence. Again, this is important, but not before oxygen. Self actualization. So now we're at the top. This is becoming the best version of yourself, setting goals, growing, learning, kind of what we're all doing as students, right? We have a goal, become the best version of ourselves, get that degree. This is awesome, but let's be honest. If your patient is actively bleeding and dying, they're probably not worried about reaching their full potential today. Okay, so how the NCLEX uses Maslow. So how does the NCLEX actually use Maslow? Simple. It gives you four answers, okay? And they're all good things, but only one of them addresses the patient's most basic need. For example, a patient is short of breath and says, I'm really scared. What do you do first? Do you comfort them or improve their breathing? You improve their breathing. Because once they can breathe, then they can calm their anxiety. Okay, another example. A patient wants education about their new medication, but they're actively bleeding from their IV site. What comes first? You stop the bleeding. Education can wait. Safety can't. Okay, so this is how I want you to remember Maslow forever. Think of it as climbing a ladder, okay? You can't climb to the next step until the step below you is solid. Or think of your phone. If your battery's at 1%, are you customizing your wallpaper? No, you're looking for the charger. Your body works the same way. When you're fighting to survive, everything else moves down the priority list. Okay, you can't reach the top if the bottom isn't stable. Remember that. Okay, so ABCs, the NCLEX's favorite priority framework. Okay, so I'm not talking about the alphabet. You probably already heard about the ABCs. So it stands for airway, breathing, circulation. If you don't know these, you're going to miss a lot of priority questions. So know this. The good news is that it's actually really easy to understand. So, A, airway. Ask yourself one question. Can air even get into this patient's lungs? Because if the airway is blocked, nothing else matters. Okay. No airway, no oxygen. If there's no oxygen, there's no life. So think about things like choking, a swollen tongue, airway obstruction, stridor, a patient who's unable to speak. Those patients are emergencies. Why? Because if air can't get in, then breathing can't happen. Airway is the doorway. Remember that. If the door is blocked, nobody gets inside. Okay, so next comes B, breathing. So now that the airway is open, but is the patient actually moving air? Are they breathing effectively? Look for things like shortness of breath, increased respiratory rate, low oxygen saturation, cyanosis, diminished lung sounds. If they're not breathing well, this is your priority. So next is C, circulation, finally. So now we're asking, is blood getting where it needs to go? Think about severe bleeding, very low blood pressure, weak pulses, poor perfusion, chest pain. Without circulation, oxygen can't get to your organs. That's why circulation is still incredibly important. It just comes after airway and breathing. So let's do like a little bit of practice. So patient number one, a patient has a broken wrist and says that their pain is a 10 out of 10. Patient number two is choking and can't speak. Who do you see first? You know this, the choking patient, every single time because pain matters. Yes, it matters, but oxygen comes first. Okay, another one. Patient number one is crying because they are scared about their surgery. Patient number two, their oxygen saturation just dropped to 84%. Who comes first? Again, you got this. Who is it? The patient whose oxygen saturation dropped. Because fear is important, but oxygen is life. Okay, one more. Patient number three. A patient has nausea. Patient number two is bleeding through their dressing. Who comes first? The bleeding patient, because circulation comes before comfort. Okay, so ABCs don't always work alone. Here's a very important thing that students don't realize. So ABCs are powerful, but they're not the only tool. Sometimes you'll see ABCs together with Maslow and ADPIE. So let's say a patient is short of breath. ABCs tell you that breathing comes first, right? Maslow tells you that breathing is a physiological need. And ADPIE reminds you to assess the patient before jumping into interventions, unless the patient is in immediate danger. So you see how they're all working together? That's exactly how real nurses think. And you will get this as you go on in your program, as you get more practice, you will understand how to think like a nurse a lot better. Okay. So just a little recap. Think of the ABCs like building a campfire. First, you need air. Without air, nothing happens. Then the fire has to actually burn. That's breathing. Finally, the heat spreads everywhere. That is circulation. If there's no air, there's no fire, there's no breathing, there's no oxygen exchange, no circulation. and oxygen, there's no oxygen in the body. Okay. Alrighty, so let's move into putting it all together, the survive and thrive method. That's me. Okay, so we've learned how nurses think, we learned ADPIE, we learned Maslow, we learned the ABCs, and now we're going to put it all together. Because here's the truth. The NCLEX isn't going to ask you, hey, are you using Maslow in this question? Or, hey, use the ABCs here. No, it mixes everything together. That's why students feel very overwhelmed. They're trying to remember 20 different rules. Instead, I want you to remember one system, and I call it the survive and thrive method. So, number one, you need to ask yourself, who is crashing? Is somebody choking? Can they breathe? Actively bleeding? Unresponsive? If yes, then that's probably your priority. Life-threatening problems always come first. Step two, if nobody is crashing, I ask myself, what does the patient need right now to survive? That's Maslow. Do they need oxygen, food, water, safety? Or is this something that can wait? Remember, survival always comes before comfort. Then I ask, have I assessed the patient yet? Because one of the biggest mistakes that nursing students make is jumping straight to interventions. If the patient says, I'm dizzy, some students immediately want to call the provider. But hold on, did you assess them first? Did you check the blood pressure? Did you ask questions? Did you get enough information? Remember, we're detectives, we're gathering clues. Remember, assess before intervening unless your patient is crashing. And then step four, finally, ask yourself, you are the nurse, okay? Ask yourself, what can I do right now as the nurse? The NCLEX loves to give you answers that sound more important, but they're outside of the nurse's role. For example, a patient has chest pain. One answer says prepare the patient for emergency heart surgery. Another one says assess the patient's pain and obtain a 12-lead ECG. Which one is the nurse's priority? The assessment, because nurses don't skip straight to the biggest intervention. We start with what we can do safely and immediately. Okay, so for every NCLEX question, you ask these 4 questions in your head, okay? Not because you memorize them, but because this is how nurses actually think. Okay, so now you've got the tools. Now we're gonna do some practice with some NCLEX style questions. Pause the video after each question, pick your answer, and don't worry if you get it wrong because we're gonna go through them all, okay? Alrighty, so let me see. Question number 1, it says, a nurse is caring for 4 patients. Which patient should the nurse assess first? A patient who reports pain rated 9 out of 10 after surgery. B, a patient whose oxygen saturation has dropped to 84% on room air. C, a patient who is requesting discharge instructions. D, a patient who is anxious about tomorrow's procedure. Go ahead and pause the video if you need more time. And the correct answer is B, the patient with an oxygen saturation of 84%. We're thinking like a nurse, okay? So the first question we have to ask ourselves is, who's crashing? And oxygen saturation of 84% tells me that this patient is not oxygenating well. That's an immediate priority, okay? So we need to break down the other answers and understand why they are wrong. So pain, 9 out of 10. Pain matters, but pain does not kill the patient before the lack of oxygen does, okay? That's not the priority. Okay, C, discharge teaching. That is important, but it's not urgent. The patient's not going to die while they wait, okay? Anxiety, for D, anxiety is real, okay? But before I can help somebody emotionally, I have to make sure that they're getting enough oxygen so they don't die, okay? Remember, oxygen before comfort. Okay, question number 2, it says, a nurse enters a patient's room and the patient says, I'm having chest pain. What should the nurse do first? A, administer nitroglycerin. B, notify the provider. C, assess the patient's chest pain using OPQRST. D, prepare the patient for cardiac catheterization. Okay, pause the video. The correct answer is C, assess the patient, assess the chest pain using OPQRST. Remember ADPIE. Assessment comes first, okay? We need to remember that assessment comes first unless your patient is actively crashing. Then you need more information before jumping into interventions. So let's eliminate the others and understand why they are wrong. This is important, okay? So A, nitroglycerin, maybe. But what if their blood pressure is dangerously low? You have to monitor blood pressure when administering nitroglycerin, okay? So you assess first, okay? So B, notify the provider. Not yet. We have to gather more information still. Okay, D, cardiac catheterization. That is way too far ahead. You need to think like a nurse and assess first. Okay, question number 3. A nurse is caring for 4 patients. Who should the nurse see first? A patient who has not eaten breakfast. B, a patient who is crying after receiving a new diagnosis. C, a patient with inspiratory stridor after surgery. Or D, a patient requesting a blanket because they're cold. Pause the video. The answer is, and I know that you got it right, C, inspiratory stridor. Whenever you hear the word stridor, your brain should immediately think airway. A patient with stridor may have a partially blocked airway. So you need to remember your ABCs. Airway comes before breathing. Breathing comes before circulation. And the other patients need care, yes, but this patient may lose their airway. Okay, so NCLEX question number 4. A nurse is caring for 4 patients. Which patient should the nurse see first? A patient with blood glucose of 58 who is awake and alert. A patient who reports new confusion and suddenly can't state their name. C, a patient requesting pain medication. Or D, a patient asking when lunch will arrive. Pause the video. The answer is the patient with sudden confusion. Why? Because sudden confusion is a red flag. It could mean decreased oxygen to the brain, a stroke, low blood sugar, infection, or another acute change, okay? On the NCLEX, acute changes beat chronic conditions. So we're going to talk about answer A. A blood sugar of 58 is low and absolutely needs treatment, but this patient is awake and alert, which means that you can likely treat them promptly with a fast-acting carbohydrate. The patient with a sudden change in mental status could have several life-threatening causes and needs immediate assessment. Okay, NCLEX question number 5. Last question. A nurse is caring for 4 patients. Which patient should the nurse assess first? A patient who says, I feel dizzy when I stand up. B, a patient with heart failure whose weight increased 5 pounds in 2 days and who now has crackles in both lungs. C, a patient requesting assistance to the bathroom. Or D, a patient asking for the scheduled stool softener. Pause the video. The answer is the patient with heart failure. So we're going to use the survive and thrive method. Who is crashing? The patient gaining 5 pounds in 2 days with crackles in their lungs, showing signs of fluid overload and worsening heart failure. This patient is at risk for pulmonary edema and worsening respiratory status. The dizziness is important. The bathroom is important also. The stool softener is definitely not urgent, but the heart failure patient has the highest risk of becoming unstable. You need to ask yourself, who is the least stable? That's usually your priority. Okay, so here's what I want you to remember. So stop trying to memorize thousands of facts. Instead, train yourself to think like a nurse. Every single question, ask yourself, who is crashing? ABCs, Maslow, ADPIE. If you can answer those 4 questions, you're going to stop guessing and start thinking like a nurse.